Okay, this is going to be take 326 of my wound care video. So this is what's going to happen. I'm going to knock on the patient's door, and then I'm going to come in. I'm going to put the privacy screen over. I'm going to wash my hands. I'm going to don some gloves. I'm going to introduce myself to the patient. Hi, my name is Brianna. I'm going to be your student nurse today. And then I'll ask them if it's okay if I change their dressing on their wound. Hopefully they'll say yes. And then I'm going to go ahead and I'm going to check the brakes on the bed, make sure those are on. I'm going to make sure the guardrail's up as I raise the bed to the perfect level. And then from there I'm going to lower the guardrail so I can assess their wound. And then I'll check their wristbands and I'll ask them to state their first and their last name. Then I will ask them their date of birth, and they'll give me those, and that'll make sure I know it's the right patient. From there, I'll ask them if they have any allergies to any medications, any latex, any iodine. They'll say no, or they'll say yes, and then that'll change my course of action. But the first thing I'm going to do is I'm going to go ahead and set up my trash bag. That way it's ready to go. I'm going to keep it over there, so not in this area. And then I'm going to, actually it's already there, but I'm going to place a sheet or something to catch the irrigation from the wound underneath them. From there I'm going to set up my little Q-tips that I'm going to use to, I actually like taping it right here. I think that's, for me that's my preference because it's easier to get to. Then I'm going to set up my irrigation, which I have right here, which I will perform. Actually, let me put some more in there. I'll use my solution, put some more in there. So it's right, I can't really see it, huh? Okay, it's right there. Sorry, it's like set up weird. I don't really have anybody to record this for me. And then I'm just going to start. I'm going to do a push-pull method on the bandage, making sure to be very gentle and not go against the hair, but go with it. I'm telling the patient it's going to be over very soon, even though we just started. And then I'm going to go ahead and take a look at the bandage. And I note some sanguineous fluid, which it's mostly blood, but I do note some granulation, and I see approximated edges, which means it is in fact healing. I'm going to go ahead and throw that bandage away, and then I am going to, actually I'm going to change my gloves, but I'm kind of low on gloves, so we're just going to say I changed my gloves. And then I'm going to go ahead and go to my little sterile packet here, and right underneath the top is going to be some forceps for me. I'm going to gently take those, making sure not to touch anything inside the packet. So I'm going to take these forceps and I'm going to unpack the wound gently, and then I'm going to toss them. And then from there I'm going to go ahead and start with measuring the wound. So I'll take a stick. I'm going to measure the length. And I have my little sheet here. You can't see it because of the print, but it'll help me estimate the proper length. Looks like about 10 centimeters in length. I'm going to go ahead and do the width. About 7 centimeters. And then we're going to go ahead and do the depth, being very, very gentle. That looks about 3 centimeters in depth. Toss that. I'm going to grab a new one. And I'm going to check for undermining and tunneling of the wound, just being very careful. And there is none. That is fantastic. Okay. Then I'm going to take these gloves off. Put some new gloves on just because I'm a clean freak, which is a good thing. And I'm going to go ahead and start irrigating. And I'm going to do so in a manner that is 2 inches above the wound, but also making sure to be very careful. And I would irrigate until the fluid runs clear when it does that. Okay, and the fluid is now clear. Go ahead and put that back. Put that over here. I can toss this now too. And then I'm going to go ahead and set up my sterile field. Okay. So I'm going to open it up. hands are clean, and then I'm going to take my sterile field here, being very careful only to touch outside. Okay. Okay, and then I'm going to open it away from myself. Taking that. Okay. And then, oh, there's something underneath it. I'm not touching it, I'm just underneath it. I'll take all the continents in my packet and flip it over. Perfect! Okay, and I haven't touched anything yet, but I'm going to put some solution in this tray just so I can have something to put my wet bandages in. Okay, and now I'm going to put my sterile gloves on. Okay, I'm turning to the side. I'm not placing my back. I'm good. And then I'm going to put on some sterile gloves. Here we go. Alright. I can do this. Sorry, I need some motivation. Okay. There we go. Oh yeah, that's smooth. Okay. And then only touching the inside. Perfect. Please. Please, please, please. Yes! 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 Okay, sorry. Sorry, I get a little excited. Okay, so my sterile gloves are on. So now I can go ahead and mess with all this stuff. And I am going to, first I'm going to put my wet dressing, well, I'm going to make it into a wet dressing, into the little bin over here. That way I can pack it when I'm ready. Okay. And then this is still sterile, so I can, oh, now I am very concerned, but I know it's still sterile, so I'm fine. And then I'm going to take my little wound cleaners, I'm going to do one swipe, and then I'm going to toss it, because we don't want to do more than one swipe. One swipe here, good. Another swipe there, boom. Perfect. Toss, toss, toss. Next thing I'm going to do, I'm going to pack the wound, taking my forceps, squeezing out any excess fluid. It's fine, I have more gauze. Squeezing it out. Pack. And then I'm actually going to take another one of these because I am very clumsy. Squeezing out some excess fluid. And go ahead and pack it in there nice and tight. Normally I would have more, but unfortunately I just dropped it. So then I'm going to go ahead and get rid of that. I'm going to place gauze over the wound, and it's supposed to reach the outside. Okay, and then I'm going to take this, which has never been used before, and I'm going to be placing this on the wound like so, which is the bandage. From there, I'm going to window tape. Make sure it sticks. Boom. So from there, I would initial it, and I would say the date and the time. I would ask the patient if they had any questions or anything like that, any concerns, if they're in any pain. Hopefully they're not. And then after that, I would raise the guard rail back up, check the brakes one more time, lower the bed, make sure their call light is within reach, and then I would come and check on them when I'm supposed to. And that's it.